Is it already recording?
No, not yet.
Okay.
Hey, y'all need to turn around. Can y'all turn around real quick, you guys? Okay. Regina.
Okay. In 2009, it was determined that the non-medical use of prescription pain relievers was the second most common form of illicit drugs used in the United States after marijuana, according to the National Survey on Drug Use and Health. The Center for Control Disease and Prevention stated that $78.5 million a year goes towards what they call the economic burden of prescription opioid misuse in the United States. Dr. Wilson M. Compton, Deputy Director, House Committee of Energy and Commerce, states that the national problem that affects public health as well as social and economic welfare. There are a variety of uses of narcotic drugs that can improve the quality of life to those that they're prescribed to. Working in the pharmacy setting exposes me to these patients as well as makes me responsible for knowing the state regulations on how they're used. In order to understand the growing addiction of narcotic prescriptions, we will discuss the types of drugs being used, as well as the common reasons of abuse, and what is being done to prevent the abuse. We will first discuss classifications of the drugs, as well as the types of drugs being used. Drug classifications are divided into 5 schedules. They decrease in severity from 1 to 5. Schedule 1 being the most severe, and there is no current acceptable medical use with a high potential of abuse in the United States. Schedule 2 are the types that are being discussed today. They also have a high potential of abuse and can lead to severe psychological and physical dependency. The National Institute on Drug Abuse labels 2 types that are most commonly abused as stimulants and opioids. Both stimulants and opioids have clinical use, but they both have a high potential of addiction and abuse, and it is very prevalent in the United States. I will shift focus towards opioid addiction and the epidemic sweeping the nation. The question then is sparked: what is causing the rising abuse of opioids? According to Wilson, the scale of prescription opioids tripled in between 1999 to 2011. An article written by Jane Maxwell, senior research scientist of the Addiction Research Institute, discussed the introduction of OxyContin by Purdue Pharma in 1996. This particular medication was largely advertised as being at low risk of addiction, which was proven to be false. Physicians were poorly informed on the potential effects of this medication, and in 2007, the company and 3 executives pled guilty to criminal charges of misbranding this medication as of claims of being less addictive. There are a number of untrained physicians that are increasing without the full knowledge of appropriate uses of opioids and the levels of prescription opioids, as well as lacking in following the standard practices and regulations with these medications. Wilson also says that there's an unfounded concept that opioids prescribed for pain would not lead to addiction, which also was a huge misconception that linked to an increase in prescription opioids and their abuse. This also led to an increase in pill mills and pain clinics that were used by people that wanted to misuse opioids across the nation. Physicians prescribed excessive doses of opioids, which also increased the amount that were available for diversion. This brings us to the discussion of what is being done to prevent the abuse. The National Institute on Drug Abuse holds largely responsible the physicians to be able to discern potential drug abuse, as well as being presented with the symptoms and pain management. Educating prescribers to be able to identify the predisposing of certain addiction of these medications can help lower unnecessary exposure to narcotic pain relievers. Another effort of regulation is implementing federal and state policies that include educational initiatives, aggressive law enforcement against pill mills and doctor shopping, and properly educating practitioners on what opioid prescribed guidelines and regulations are. With these state and federal policies in place, Wilson believes that they can lead to a reduced availability on prescription opioids and their related deaths. The National Institute on Drug Abuse also largely contributes research towards the formulation of medications that can have a lower risk of addiction. These medications are classified as abuse-resistant opioid analgesics that can be alternatives for prescribers to use in treating chronic pain. The narcotic prescription abuse will continue to be a critical issue in our nation, but with the discussed efforts of research and regulation, the abuse can be minimized. Prescribing opioid narcotics do have proper clinical use and can successfully treat chronic pain with the understanding of high risk. It is still the responsibility of all who are involved to ensure that the abuse is limited.